Can we talk about, I guess, just the FDA authorizing the latest vaccine against the fight against coronavirus?
Yes, this is great news because now we have three vaccines, which will help us increase the distribution very rapidly to try and get more people immunized as quickly as possible. So this is another breakthrough, and I'm very happy to have three vaccines now to help us control this pandemic.
Absolutely. Can we talk about how the production as well as the distribution of vaccines has ramped up for Louisiana?
Well, we are very likely to continue to get more and more doses each week, which means that we'll be able to go through the groups of people that have already been authorized to get the vaccine through the state plan, and then expand that to more individuals, as you've seen over the past few weeks, that we've now added more groups of people to the list who can come forward and get vaccinated. So this is a real good real good event in the sense that we now have three manufacturers who are able to provide us vaccines. And as you know, Pfizer has increased production, and so we should get more doses of Pfizer vaccine. J&J has some millions of doses that they're already able to start shipping. So I think we should see more and more vaccine each week. And then we'll need to work to try and increase our ability to distribute it so that as soon as we get it, we could put it in people's arms.
And the ramping up of vaccines and the approval of a third COVID vaccine comes as some experts are worried about the spread of COVID variants. Can we talk about just the variants in Louisiana right now? Is that a major concern for y'all?
Well, the variants are a major concern. And so we're really in a race right now to try and get more people immunized as quickly as possible to help fewer people become infected so that fewer people could be infected with the variants that are out there. I think that the variants are a challenge. This virus will continue to mutate, and the more people that are infected, the greater the number of mutations. And as you know, the UK strain, the CDC believes that somewhere in the middle of this month or so, that may become the predominant strain in this country. And the South African strain has already been seen in 10 states in the United States. And CDC just indicated that based on their data, it looks like we're beginning to see community spread of the South African variant. So I think it's really important for people to understand that, yes, the vaccines are coming, that there are more people who are going to be able to get vaccinated, and we need to do that as quickly as possible. But to reduce the number of cases right now, we still need to do the mitigation strategies that are so important to reduce the number of people that are infected. So that means we need to continue to use our masks. We need to continue to keep social distancing. We still need to have no more than a few people meet simultaneously. And so it's really important that we follow the rules, because right now we're not going to get full control of this virus until we get enough people vaccinated.
One of the good things about these vaccines is their efficiency with all of the strands that have been identified at this time. But I know it just takes that one mutation, kind of like when we create a flu vaccine and the predominant strand of that year isn't, the vaccine isn't effective against it.
Yeah, that's a very good point. Right now, even though, for example, the J&J vaccine that has just been licensed with an emergency use authorization appeared in the studies to be less effective against the South African strain, but it was still over 50% effective in reducing cases of moderate to severe disease. So it still is going to be very helpful to us in our control of this pandemic. On the other hand, the more people that get infected, the more likely there might be variants that emerge that would make it difficult for the vaccines to work, which would mean that we would then have to reformulate the vaccines and perhaps have booster doses of vaccines that have modified strains in them or modified variants based on the fact that new variants will emerge that may not be as effectively controlled by the current vaccines.
And just as you mentioned earlier, that's why it's super important to continue those mitigation efforts to curb the spread of COVID-19 while a vaccine isn't available to everybody at this time.
Yes, it's critical to maintain the mitigation strategies. We are not going to see the full effect of vaccines until we get approximately somewhere between 70 to 80% of the population immune to this virus. And immunity can be by vaccine. Unfortunately, some of the immunity is by infection with all the complications of infection. So we really want to make more people immune through the vaccine. So mitigation strategies are critical to help us in this vaccine rollout.
And is there anything I didn't ask that you would like to add?
Well, one thing that's important about the J&J vaccine is that it is a single dose vaccine. So we get significant protection with one dose, which may also help us control this pandemic. In addition, it's easier to store the J&J vaccine, which means that it could be distributed a little easier than the other vaccines. So each of these vaccines is going to play a particular role, and they're all important in the control of this pandemic.